everyone. Today we have an amazing episode. The name of this episode is why it's so important that you make sure your dentist communicate with your physician and your specialist and dentist. They all have to communicate before they do any complex dental treatment in your mouth. So let's say your mouth has several problems and before you didn't know how to take care of it, you didn't see my videos. This is an episode number 2, season 1, where I talk about why it's important brushing, flossing every single night. And in that episode I showed why, because otherwise you're gonna finish up like this patient. This patient needed root canals, have a cavity here, has the need of root canals in this area. Then the patient lost a tooth on the front, so it needed an implant. And how do we make this treatment work perfect in your mouth? Well, the main thing to do is your dentist first, if you have any medical compromised disease like high blood pressure, heart disease, diabetes, he has to be sure that if you are a high-risk patient who has some medical compromise issues, or if you have knee replacement or hip replacement and you need antibiotic 1 hour before your dental treatment, we need to be informed. And if you as a patient forgot, I always ask, who is your physician? If I see anything on the medical history, it's a little bit suspicious, I usually call the physician to have a letter signed that I can use antibiotics, I can use anesthetic, and what can I use for this patient so it doesn't get medically compromised during the dental treatment. And why did I tell you that? If you have a problem with your bite and if your bite is crossed, then the restorative doctor is going to have to talk to your general dentist. With your if it's a prosthodontist, they talk to the general dentist if the general dentist is going to do any treatment. If it is with let's say you have a gum disease, then your dentist have to send you to see the periodontist. And why did I say that? Because as you see here, when the patients have all the bone in the mouth, it's not a problem. This is the bone and the roots. But when the calculus that you see here, like a yellow colors here, and this is a calculus that the patient has all over, and the teeth by this are moving to the point that they're gonna fall, then they need to send you to see a periodontist to have a consultation to see if one of these teeth can be savable. Maybe they're gonna say, well, this teeth is moving too much, he lost a lot of bone, the gum is receded, let's take the smaller out. Then do we need to put another tooth here? Sometimes people say, why do I need an implant? Why do I need to have something placed there after they take my tooth out? Because if they take your tooth out, let's say this tooth, and they don't put anything, your lower tooth start growing and start getting out of the mouth until it finds the stop, which will be your gum. And then these teeth are gonna be moving in a different ways. The other situation, he needs to be sure, your dentist, and if you're grinding your teeth and you're gonna have veneers in all the mouth, then you need to have an eye guard at the end of the treatment. Now, what happened when they said, well, I am a dentist that just specializes on the anterior teeth, and I only do veneers, and I specialize in a smile? It's not such a thing of a specialty. What it is that I hope the dentist, and I'm sure they do it, probably the patient needs to understand, but the dentist has to be sure the posterior teeth of this patient are very solid so the patient can have his functional work in the mouth exactly the way it has to be. Because if they put beautiful veneers and you're a patient that you're grinding your teeth all the time, what is going to happen? If you see here the patient has a crown, a veneer, if I start doing this, then the tooth is going to start getting loose until the tooth is coming out or the veneer is coming out. And if you are an actor and you go to a show and the tooth wasn't done correctly because you're even if it was perfect, but you're a heavy grinder and you're not using a night guard, then this tooth eventually you're gonna break the seal of the cement and it's gonna come out of your mouth. And that's why it's important that before you have an investment for the whole treatment of your mouth, you gotta be sure that your dentist, I'm gonna go to the screen here, that the dentist, you have to remember this. This is a gift that I'm gonna give you. Your dentist is like the captain of the boat. I always tell the patient. It can be your prosthodontist or restorative dentist. Prosthodontist is the specialist that takes care of prosthetic dentistry. They have a 3-year specialty. And the dentist also that does restorative dentistry, they have to know if the patient needs a root canal or what are we gonna do for the root canal. Well, we're gonna send it to patient, like the screen is here, to an endodontist. So what they're gonna do, root canal. What about if the gums? What about if the gums are irritated? The patient has to go, like we see here on the screen again, to a periodontist. And then you come back to your dentist and then you realize these wisdom teeth, are gonna be on the way. And these are the wisdom teeth and are inside of the bone. So the oral surgeon has to take a look and has to plan with the dentist always when are gonna be that wisdom teeth taken out so they will not mess up your whole treatment. Once the oral surgeon check you, or if at the end you're gonna need orthodontic treatment, or before or after another treatment, the dentist and the orthodontist have to be in constant communication. If we don't communicate with our restorative doctors, our prosthodontists or dentists, the treatment can be jeopardized. And sometimes it works because my chairman in Mexico used to say that God knew it was gonna be a lot of us here in the air, and the body is gonna respond no matter what we do, but it's not gonna respond in a good prognosis and a long term. So if you wanna have a long treatment plan or even a small treatment plan, it doesn't matter. Always remember, listen to your dentist first, or your prosthodontist. Prosthodontist is the prosthetic dentist, or restorative dentist. Whoever is in charge of your mouth has to be reported by us. I'm an endodontist, I have to report the dentist, what I'm gonna do, the perio, etc. So the overall treatment is gonna be performed in an amazing, professional and complete way, so the prognosis of your restorations are gonna be in a long term. If you have any questions about this topic, don't forget you can send me your comments to the YouTube channel, Dr. Fanny Yakaman, and I will be happy to assist you. If you want me to talk to your dentist or you want me to take a look at some x-rays, I will be happy to do it. So if you have any questions or comments, don't forget to leave it before, give us a like, and follow us in our program in YouTube, Instagram, and TikTok. Thank you.